Good morning, everybody. It's very early here in UK, but it is so lovely to be here. And thank you ever so much for your kind invitation. I extend my sincere thanks to the Sri Lankan Society of Lifestyle Medicine. It's a great pleasure to be here. And as she already mentioned, I'm primarily an anesthesia and pain management consultant, but also practices lifestyle medicine here. I was certified by the International Board of Lifestyle Medicine with through the British Society of Lifestyle Medicine. So I do not have any financial conflict of interest about this particular lecture today, but I have a portfolio career as I am practicing anesthesia and pain management along with the lifestyle medicine. As a professional role, as she mentioned, I'm a faculty and examiner at various pain organizations and societies, and also pain lead for the London Society of Regional Anaesthesia. I'm the core committee member of the Regional Anaesthesia UK, and I have to say I'm an ultrasound enthusiast, doing education as well as other many books as well. So today, what I'm going to do is just to introduce you to the newer concept of lifestyle medicine, especially looking after diabetic patients, and also have the idea whether the true diabetes reversal or is it the remission that we are talking about is possible through lifestyle medicine. So I'm going to present to you a case study. I saw this patient in June time last year. He's a 50-year-old male, IT professional with an 18-year history of hyperlipidemia who is taking 2 medications, more than 10-year history of diabetes on glucose-lowering medication, metformin, he is taking twice daily. He also had some cutaneous changes of diabetes with the recurrent sinusitis and loss of smell, which was happening for nearly 10 years, musculoskeletal pain in multiple joints, and he was quite anxious about his health outcomes in the future, which is quite understandable. So if you are the clinician, what you will do for this patient? I want you to keep that thoughts in your mind while you are listening to my lecture, and we will come back to this particular case at the end of the lecture as well. So there are a few more parameters which I would like to share. One is the weight was 76 kilo, waist circumference 34 inches. His HbA1c was 7.5%. Triglyceride 179 and HDL 23, and vitamin D level was quite low. The ultrasound abdomen and pelvis showed grade 1 fatty liver, gallstones, and prostatic hypertrophy. So if you are the clinician looking after this patient, what you would do for this patient? So today I'm going to cover the background about the diabetes and the lifestyle medicine, pathophysiology, which is from a completely different angle. We will look at it. Diabetes reversal process, challenges and the approaches as mentioned in the heading of today's talk. So the background, as we all know, diabetes is becoming a major issue globally. If you look at the left-hand side, this is from the International Federation of Diabetes. And you can see in the Asian region, especially South Asian region, there is almost like a 68% increase in the incidence of diabetes. So India and Sri Lanka comes in the red zone region. And also specifically in the Sri Lankan area, the incidence of diabetes is much higher than even Indian subcontinent. So the diabetes disease burden as such in the Southeast Asia, if we look at them, 1 in 11, which is quite a significant number, are living with the diabetes. But what is more worrying is that over 1 in 2 adults living with the diabetes, they are undiagnosed. So they present with a complication. So 3 in 4 diabetic patients or the incidence of diabetes, they are living in a low or middle income countries as well. 6.7 million deaths are due to diabetes in 2021. So this data is the 2021 data. So as we are expecting the diabetic number or the patients with the diabetes is going to go up, this is going to place a huge financial burden on every healthcare system in our world. So if you look at the lifestyle diseases as a whole, type 2 diabetes is the number one on top. And all the other diseases which they have mentioned as heart disease, hypertension, metabolic syndrome, renal failure, everything comes under type 2 diabetes. But if you look at them carefully, you can see all of them are related to type 2 diabetes, as the heart disease, hypertension, and metabolic syndrome. Even renal failure is part of the type 2 diabetic complications. Females, PCOD is the commonest reason for early diabetes as well. And obesity and depression comes along with that. And as a complication, patient can develop stroke as well. So they could be independently a lifestyle disease or a part of the type 2 diabetes complication. Even other diseases, if you look at them, most of them do have some connection with the type 2 diabetes. So the type 2 diabetes management becomes almost like a cornerstone for majority of the lifestyle related diseases. So why the lifestyle related diseases are on the rise? The main reason is the rapid changes in the gut microbiome during the human evolution. So the gut microbiome becomes a major part of my lecture today, because this is something that we miss even when we talk about lifestyle medicine. We do not give enough attention to the gut microbiome as well as the gut dysbiosis as a primary cause or the root cause of major or main lifestyle related diseases. So during the evolution, in this article, they have very clearly said our ancestors, like the wild apes, they had a variety of gut microbiome, but during the period of this modernization and the Western diet consumption, the diversity of the gut microbiome has gone significantly lower, as you can see in the USA. And also this has given rise to the gut dysbiosis, which is the primary cause of pathology or the pathophysiology of diabetes. As lifestyle medicine, we all are familiar with the 6 pillars of the lifestyle medicine, which includes the exercise, nutrition, and risky substances, stress management, sleep, and healthy relationship. So I will address that separately at the later part of the lecture. So as modern medicine physicians, if we compare the modern medicine with the lifestyle medicine, how do they compare? So in modern medicine, majority of the time we spend in the acute or symptom management, and the investigations become another major part of our time-consuming process. But the root cause analysis of each problem or each clinical presentation becomes a very narrow part of our clinical practice. But in lifestyle medicine, in contrary, we do spend a lot of time on the root cause analysis and the preventive aspect, and also the investigation to confirm your root cause, and then the symptom care or the symptom care burden becomes lesser. So when we are practicing lifestyle medicine as a modern medicine physician, if we combine these two together, your patient will get the better outcome and your practice will be better as well. So let's look at the pathophysiology from a different angle. I'm not going to teach you the true pathophysiology of diabetes. As a clinician, you all should be very familiar. But if you look at the pathophysiology from a different angle, probably we will be able to understand why this is becoming a major problem in spite of medication management, which is the conventional medical management. So as we know, there are different types of diabetes. We talk about the type 1 and the type 2 commonly, along with the gestational diabetes. But the young people maturity onset diabetes, like the MODY, as well as the type autoimmune type, which is 1.5, which is LADA in adults, are increasing latently. Type 3 diabetes, as we know, it is Alzheimer's disease, as well as the pancreatic dysfunction, which is type 3C. The transient neonatal diabetes is something that can be presented as adult onset diabetes later in their life as well. And the ones on the bottom are not very common, but they are rare genetic disorders as well. So we talk about type 2 diabetes because that is the main one, that is where we talk about the reversal, when we talk about the reversal or complete remission. So what is type 2 diabetes? As we know that it is a lifestyle-related disease, which is affecting almost every organ in your body. It is not just the high sugar in your blood, but it affects every organ, including your liver, pancreas, your muscles, your nervous system, everything. So the complication of the diabetes also related to these organs, because I will tell you why this is important for us, especially when we consider the glucose transport systems as well. Even if you have a controlled blood sugar level, you may still get diabetic complications if you are not careful about your lifestyle management. So when we had COVID infection in 2020, everybody was scared about people with diabetes. What was the reason? Because the COVID virus, as we all know, it enters into your body through the ACE2 gene, and also it causes vasculitis, significant vasculitis in almost every part of the body. And people do get vascular symptoms, cardiac problems, renal problems, metabolic problems afterwards, and also immune response, which could be inappropriate as well. And you can see why this is connected to the diabetes patients as well. So the cardiovascular problem, if you are specifically looking, because this is the commonest one that we see in our clinical practice, almost all the cardiac problems are related to increased insulin resistance and glucose intolerance, which will cause increase in the blood pressure and the systematic inflammation in the body with the dyslipidemia, which will lead to the endothelial dysfunction. And this is leading to the cardiovascular events as a heart attack or coronary artery disease and the heart failure that we see in diabetic people, and of course, sudden cardiac death. So it is a multifactorial contribution from the diabetes, which is causing the cardiac complications. So if you think about our old physiology, if you think about the glucose transport system, so we have the blood transportase 1 to 5, as well as the sodium dependent glucose transport system, which is predominantly in your gut. So the GLUT, if you look at the GLUT transportase 1 to 4 as well, which organs they are hosting, you will see the GLUT4, which is seen in the skeletal muscle, adipose tissue, as well as part of your heart, is the only GLUT transport system that is insulin dependent. All other GLUT transporters are independent of the insulin level, which basically means if I have got hyperglycemia, all these patients will be getting increased sugar levels in all other organs and causing the protein to coagulate with the increased sugar level, causing the advanced glycoprotein, which will get deposited. And this is one of the reasons the type 3 diabetes, we say Alzheimer's, you get the plaques in the brain as well. And that can be the explanation for multi-system involvement when you have this uncontrolled diabetes or uncontrolled sugar levels. Okay, so the risk factors or the pathophysiology for especially people from our part of the world, one is the ethnicity of our people, and also family history along with the genetic predisposition. Obesity and the low physical activity and unhealthy diet is another risk factors. When we talk about obesity, it is not the standard Caucasian measurement that we should be looking. Asians should have a lower BMI as the mark rather than going for the 25 BMI. And also the pathophysiology of the beta cell dysfunction is another risk factor. So what are the predisposing conditions perpetuating to type 2 diabetes? One is the nutritional factors in our part of the world, especially using high sugar in the form of high carbohydrate and also high fat Western diet, which we have recently adopted, which will cause dysbiosis in the gut microbiome and also the reduced physical activity of the new modern era. People are spending a lot of time in front of the TV or other activities, which the metabolic memory, which is epigenetics, which is the oxidative stress that is people are going through when they are having all these issues. The mitochondrial dysfunction is another problem which is led to the cellular level and the problem of dysbiosis.
Sorry, I think we are experiencing some disturbance. All the participants can mute themselves.
No worries. So the type 2 risk factors can be divided into modifiable factors and non-modifiable factors. So the non-modifiable risk factors are the ethnicity and the family background or the genetic predisposition. We are born with it. But the modifiable factors are definitely the obesity, low physical activity, as well as the unhealthy diet. This can be modified, which is we are looking into the lifestyle modification when we talk about it. So the South Asians have higher intake of carbohydrate along with the saturated fatty acid and also polyunsaturated fatty acid and trans fatty acids. The lower intake of the omega-3 fatty acid than the fiber compared to other population is again another predisposing factor for us. Even though we are in a temperate climate, we seem to have a lot of vitamin D deficiency as well as vitamin C deficiency. Both will contribute to the development of diabetes as well as poor management of the glucose level in the body. So the genetic predisposition of the Southeast Asians, one is we do have poor lean mass as well as less sensitivity to insulin. So compared to the Caucasian population, our muscle mass is much less. And also we do have poor beta cell function. We tend to have more abdominal and the visceral and the hepatic fat compared to the other population. So these are the three reasons why the Southeast Asians have got a predominance or the predisposition for diabetes compared to other counterparts in other parts of the world. That is evolutionary determined. We cannot really change that much. But the response to the lifestyle is something that we can manage as well as modulate. Obesity is becoming a big issue, not only in Western world, but even in the parts of our world as well. The main reason is unhealthy lifestyle and lack of exercises. And the stress level, due to various reasons, it seems to be going higher and higher. The poor sleep pattern, especially in the youngsters, is one of the reasons of electronic gadgets, and the increased use of electronic media is one of the reasons as well. That is again leading to the lack of social and the personal connection as well. And the number of people using various substances, especially which is causing addiction, including sugar, which is most addictive aspect of your lifestyle, is causing obesity for patients. We used to have malnutrition at one point, but I would say now we are having malnutrition because everybody is going into the mal or the westernized diet concept, which is causing a big problem. From malnutrition, we are getting obesity as a big issue. Childhood obesity is going through the roof as well. The childhood obesity, one of the reasons why we are worried about is childhood obesity is something that will predispose adult obesity and which will lead to diabetes. So the babies should be breastfed at least in the first 6 months of their life. And also if you can continue that up to 2 years. From 6 months onwards, breast milk should be given along with the normal food that the parents are eating rather than going for artificial or processed food. Salt and sugar should be avoided as a supplement in their food as well. This is something that we need to learn as a cultural thing as well. We always tend to put sugar in everything that we give to our kids. So the waist circumference as well as your BMI or the body mass index is something that we always use, which is from the Westerners. For an Asian population, we need to think we should be lesser than this to have the overweight or the class 1 obesity. So the abdominal circumference that we say, if it is 40 inches or more than 102 or 35 inches in women, and the BMI associated or higher BMI associated with more than 20 diseases in most of these patients, if you have these two parameters, that is high BMI with the bigger or the higher waist circumferences. But in the Asian population, the overweight is actually 23 rather than 25 because we are short-stated people. Triglyceride is the other one that you see as a part of the metabolic syndrome. So if you have to look at the lipid profile, probably triglyceride is the most single lipid parameter that is important for the glucose metabolism marker. And the triglyceride to high density lipoprotein ratio is the predictor of cardiac risk. So when we look at the patient, we don't need to look at the total cholesterol. It doesn't make really a lot of sense. But what is important is the triglyceride HDL ratio, which will predict the cardiac risk. There are racial differences as well. Again, high carbohydrate and the saturated fatty acid in your diet is the single reason for the high triglyceride level. Non-alcoholic fatty liver disease predisposition is again because of that high triglyceride level. Actually, we see a lot of patients with diabetes with the non-alcoholic fatty liver as well. When we talk about sugar, we need to talk about the bitter truth of the sugar as well. So how much do we really need in a day? We all say that carbohydrate or the sugar is your energy source. So when you say the patient has got, the blood results shows 100 milligram per deciliter as the sugar level or the BM level, we expect for a normal individual to have less than 100 milligram per deciliter. When it is 100 to 120 milligram per deciliter, we call it as pre-diabetic, and more than 120 milligram is diabetic. Now, if you imagine an adult has got 3 liters or 4 liters or even 5 liters of blood, how much sugar is there in the blood at one given point? So if it is 100 milligram per deciliter, that means 1000 milligram in a liter, which is 1 gram of sugar in a liter of blood. So if a patient has got 4 liters of blood or 5 liters of blood, the patient can only hold 5 grams of sugar, which is equivalent to a spoonful of sugar, a teaspoonful of sugar. So imagine how much sugar you are putting into your body during each meal. So the maximum number of sugar in a whole day for kids and women are told as 6 teaspoons max, and the 9 teaspoonful of sugar equivalent for men. Sugar is one of the most inflammatory substance and addictive food that you can put it into your body as well. So the sugar is not very sweet as you are thinking. And the other reason why we are giving a lot of sugar to kids and adults is using all these drinks as well, especially the carbonated sugary drinks along with alcohol that produces, imagine a can of Coke is giving you almost 14 or 13 teaspoonful of sugar. So what happens to the 15 spoonful of sugar once you have a can of Coke? You need to think about it, where that will get deposited. The pathophysiology of the obesity and the hyperglycemia along with the hyperlipidemia is the root cause of diabetes or type 2 diabetes in most of the patients, because this leads to beta cell and also the toxic pressures causing the inflammation, inflammatory stress, as well as the metabolic as well as the oxidative stress, causing the islets of cells less integrity. This is one of the reasons why the pancreas starts producing less insulin later. So increased sugar level or the abnormal insulin sensitivity causes central obesity. That is why the central obesity, the abdominal circumference become very important. That is along with the weight gain as well as the inactivity causes progressive loss of the beta cells, along with the genetic factors that we have and the high glucose level and high free fatty acid, which is the triglyceride, which will lead to impaired glucose tolerance, which is presented as diabetes mellitus. So when you have this hyperinsulinemia, the patient will get a lot of water retention along with water and salt. So this increases the blood pressure and the atherosclerosis because of the triglyceride that will lead to heart attack and the cardiac related problems like hypertension. The high insulin level also increases the triglyceride I already mentioned, and also causes growth of certain cancer cells. In women, cause the ovaries to produce more testosterone, and that is the reason with the polycystic ovarian syndrome along with the diabetes, patients get hirsutism or the hair growth because of the increased testosterone level. So it causes a lot of significant hormonal imbalance in women. It also produces the significant risk of type 2 diabetes just by having hyperinsulinemia. So when you have high sugar, your pancreas is producing a lot of insulin, which is causing the hyperinsulinemia. And this is the background pathophysiology that happens along with the hyperinsulinemia. So we will move on to the next step, which is the diabetes remission or the reversal. Now, this is something that still nobody has agreed, or the medical world has agreed for which should be the terminology, should be whether it is the remission or should we call it as a reversal. It is still controversial. We probably are all familiar with the direct study, which was the first well-conducted randomized control trial where low-calorie diet, which I will go into detail in a minute. But this was projecting it as a remission because they said if somebody has got impaired glucose tolerance, the chance of diabetes coming back is much higher if they go back to their previous lifestyle. So rather than saying complete reversal, we should be calling remission. But most of the articles or literature, if you look through, majority of them, they are saying it is reversal as well. So if in lifestyle medicine, if all laboratory markers of the diagnostic test are within the normal range without any use of the current medication, and the patient does not have any signs and symptoms of the disease, in lifestyle medicine, we do say it is a reversal. So this is probably one of the first good articles where people started integrating the system biology, e-health, as well as the behavioral changes together for lifestyle management or the diabetic management using lifestyle medicine beyond the use of medication. As you can see, this was well-planned, conducted study as well. And this is a review article. If you are interested, please do go read. And this will give you why it is important to have an integrated approach for the diabetic management as well. So in that one, the diabetic cure trajectory was proposed as once you start within 12 weeks time, you should be during the intense cure phase, you should be able to reverse and cure by lifestyle. But after that, what is important is maintaining the changed lifestyle. Most of the time, people go back to their old habits, but if you are able to motivate the patient to continue the lifestyle, they will be able to continue the reversal that they obtained during the intense cure phase as well. So the direct study was Professor Roy Taylor as well as Professor Mike Lane conducted in the UK, where they did the study in 306 individuals using low calorie diet. So what they did was restricted a calorie to 850 calories per day. And the target was to lose approximately 15 kilos of weight. They chose the patients who are recently diagnosed, the diabetic patients who are less than 6 years' time. Out of every parameters that measured, for me, the most striking feature was this picture, which is the MRI scan of the patient, where they managed to reduce the fatty liver, which is the 36%, the visceral fat, from 36% to 2% by the end of that, by the calorie restriction and losing your extra weight from your body, which has put the patients into remission. The direct study is continuing. There is a 2-year follow-up, which they have done, where the weight management intervention for the remission of type 2 diabetes. And this is an open label cluster randomized control trial. And they said that even after 24 months, 1/3 of the patients with the type 2 diabetes, they are continuing or sustaining the remission by prolonging or continuing their lifestyle intervention. So this is a reverse to diabetes study, which was published where 430, this is recently published in BMJ Nutrition in 2020, where 438 patients were followed up for 24 months. And these patients, 67% of them used less glucose reducing medications, 28% completely stopped all the medications. But what was striking was even 71% of the insulin users were able to stop in 24 months period, which is a very important achievement as well. When we talk about all these studies, we all know that one size doesn't fit all. So the Caucasian population study that they have done, is it applicable for other non-Caucasian population or the other ethnic minority population as well? So this is one study that was done in UK as a service evaluation, where they looked at the specifically African population, and they also said that if you go for the low energy diet, achieving weight reduction, you will be able to put type 2 into remission as well. So the weight reduction became a major part of the diabetic management using lifestyle medicine. So 10 to 20% in obese individuals, which will give non-insulin dependent diabetes, marked improvement in the glycemic control as well as insulin sensitivity. These improvement can last for 1 to 3 years, even if they regain the weight back. 75% of newly diagnosed non-insulin diabetes, which is type 2 diabetes, 15 to 20% of the weight loss in the first year of the diagnosis seems to reverse the mortality rate significantly. However, not everybody gets the same response, even if you lose the weight. So this is where the genetic factors come into place as well. But the abdominal adipose tissue may be very important for the diabetes management rather than just the weight. So the hyperglycemia frequently decreases the low energy diet initiated, suggesting that the dietary energy restriction has beneficial effect independently on the weight loss as well. Exercise training comes in there because it improves the glucose tolerance and the insulin sensitivity independent of the weight loss. So the target of the diabetic remission or reversal has formed from these studies as one is choosing the heart healthy food, limiting alcohol and added sugars and also high saturated fat in your diet, and losing your weight by regular physical activity and quitting smoking, and also good quality sleep and managing stress should help you to put the diabetes into remission and reversal. This is what lifestyle medicine is all about. But what are the challenges that we are facing? As we all know, one size doesn't fit all. Social and cultural belief is probably one of the biggest challenges that we face, especially in the part of our world. The second bit is the education of the healthcare professionals as well as the patient. Because the conventional medicine is all about, even though we say diet control, we are not able to give a concrete evidence-based advice to the patients how to do it and how to monitor them. And we go for the prescription of medication very quickly. So that paradigm needs to be shifted, and they need the healthcare professionals as well as the patient need more education. Third one is the compliance. So the initial period, even if you go into remission, how we can promote that lifestyle to be continued for longer term is another question. And also the non-modifiable factors, how we adapt all these techniques and the technologies to accommodate the non-modifiable factors to give the best results for these patients. So as we know, in Sri Lanka, we are very close because I'm originally from Kerala. So we know that how we all eat, okay? So there is a whole movement where polished rice or white rice has become part of our main diet, or the polished powders. So the whole grain plant predominant whole food style has been moved out, and a lot of non-vegetarian food along with the refined carbohydrate and high sugar with a high fat and high trans fat has become part of our main lifestyle. Even healthy drinks that we think as healthy drinks, as you know, we all know that for children, what we give is predominantly sugar. If you think, compare what we are giving to our children, we can see you are giving more carbohydrate in the form of sugar rather than giving any health to the individual. If you compare that to a legume, 1 cup of kidney beans that you give, which will give 112 calories, but will give you more protein and more complex carbohydrate. So the concept of giving the healthy drinks and also making the Western lifestyle is more healthy has to be changed. So how do we do the lifestyle intervention for the remission? So I will go through individual ones. Probably the nutrition and the well-being is the most important one. Hippocrates told us many, many years ago, let the food be our medicine. Otherwise, the medicine you will be taking as your food, which is very true. Some of the patients coming to my clinic, they are on polypharmacy, many tablets a day, one tablet to counteract the side effect of the another tablet. So why and how the nutrition becomes more important part of the lifestyle medicine management of diabetes. If I ask you who you are, you may say your name, your date of birth, your address, or your job. But truly, who are you? We are what we eat, which our moms used to say. So only 1% of our gene is actually human, 99% microbiome gene. This is where the gut microbiome starts to come into the lifestyle management. So when we see all these organs, the visible organs, they are only a very small part of you, but the invisible microbiome will make you the complete human. And what is a microbiome? And the role of the microbiome in the health and diseases, and the microbiome in the mental and well-being, and how to improve your health with the microbiome, and the future will be discussed in the next few slides. So 99% of the humans are identical. We all are identical, but the microbiome is what makes you who you are and different. You have almost 10 times more cells in our body from the microbiome. And also if you're taking the gene, the ratio is 100 to 1. There are thousands of different species that has been identified in your body and predominantly in your gut. More than 90% of the lifestyle related diseases are connected to your gut and the microbiome and the dysbiosis effect. So from the healthcare, we have moved over to disease care. We need to put that back into the healthcare. That is why the concept of gut microbiome and the lifestyle medicine becomes more important for you. So the biome itself is an ecosystem made up of the flora and the fauna. The micro means we can't see, it is invisible to human eye. It is mostly bacteria, but also viruses, archaeofungi, and also they play an important role in the environment as well. So if you think about microbiome versus microbiota, microbiota is the actual organism and the microbiome is the organism and their genes together, which is part of us. So this article was published in the BMJ in 2019. Even I didn't pay enough attention to that article at that point. Probably my interest in gut microbiome started once the COVID started. So in this one, very clearly, they say the increased sugar intake and also reduced short chain fatty acids in the gut inflammation and insulin resistance, which is in the red zone, will put you into the disease condition. And if you remove that, you can move over to the health condition. And this is a very good article if you are interested in gut microbiome to read about as well. So when you have this highly refined carbohydrate along with the trans fat and the fatty food, and also all these commercially available animal products where the antibiotics as well as the steroids are given to the animals, your gut is probably like a desert. What we need is we need to have as many microbiomes as possible, like a beautiful garden in our gut. This is what going to help you in the long-term health improvement as well as your immunomodulation. So why the flora is so important? Because it is this one which is produced by the butyrate. The butyrate is produced by the fermentation of the fibers by your microbial flora. It has got a big role. It is an epigenetic modulator, and also in vitro animal studies suggest that the butyrate improves the metabolic syndrome parameters. It also improves the metabolic indices of insulin sensitivity and the intestinal GLP-1 secretion, which is your sodium-dependent glucose transport system as well. So this is why in diabetes, the gut microbiome becomes a very important aspect. And also it is suppressing the inflammation and immune system boosting as well. It also has got anti-cancerous property as well. As a pain consultant, I have got more interest in the pain and the gut microbiome connection as well. And this is another beautiful article which was published in BJA, where the pain regulation by the gut microbiome and the molecular mechanism and the therapeutic potential was described. So they have looked at nearly 975 articles which were published, and then they reviewed only 80 articles, and they said the visceral pain along with the inflammatory pain and the neuropathic pain, even opioid tolerance is linked with your gut microbiome. There are very specific issues in the pain world that we look, that includes the diabetes, which is specifically linked to certain type of gut microbial dysbiosis, along with the other conditions like abdopelvic pain, inflammatory and neuropathic pain, which we see in diabetes as well, and also autoimmune condition along with the musculoskeletal pain. So whichever way you look at it, they are all interlinked and they are connected to your gut microbiome as well. The other one is the drugs that we prescribe to these patients. So the drugs and the gut dysbiosis is another important aspect of what we need to look at. So if you look at the systematic review of this article, which was published in the Elementary and Pharmacology and Therapeutics, the human dysbiosis was induced by non-antibiotic. Antibiotic, obviously, we know that antibiotic will kill all the organism along with the pathogen and our gut microbiome as well. But one of the commonest reasons for gut dysbiosis is actually proton pump inhibitors. We prescribe proton pump inhibitors to patients left, right, and center. And most of the time in diabetic people, metformin or other oral hypoglycemic causes distension or gastric problems, and you prescribe a proton pump inhibitor. And these two medications together cause a significant gut dysbiosis in these patients. The other one is morphine. Morphine is something that as a pain physician, I was very much interested in, because morphine is another drug that majority of the patients get prescribed, which is again causing dysbiosis. So when you are addressing gut microbiome interaction and the prescriptions that we are giving, drugs we are giving, we need to be mindful. This can actually cause more harm to the patient in the form of gut dysbiosis rather than benefit to the patient. If you specifically look at the diabetes and gut microbiome, this is a Finnish study which was published in 2022 in Diabetic Care. They looked at more than 5,000 Finnish adults and the population. It is a population cohort study. And from that study, they concluded that there was a specific species level taxonomic breaches of the gut microbiome that you can detect, which will produce or predict the incidence of type 2 diabetes on long term. So the importance of that is you can actually detect who is going to develop gut diabetes because of the gut dysbiosis, and we can treat that very early, even before they become truly diabetic. Diabetes and neuropathic pain is another one which we see in our clinical practice quite significantly, because diabetes kills the nerves. So people get neuropathic pain all over the body. That includes not only the nerve pain as such, even the joint pain, the arthritis, because of the neurons in the joints as well. So this study, specifically looking at the effect of lifestyle intervention in the diabetic peripheral neuropathy with the type 2 diabetes, it was a randomized clinical trial which was published in 2018. They looked at 72 patients, and they said that lowering the blood sugar and increasing the physical activity along with the promoting the weight loss and also the diet, what they were eating, they followed these patients for 12 weeks, which is 3 months. And the conclusion was that lifestyle intervention will contribute reducing the diabetic peripheral neuropathy, because in the study, the pain relief was clinically significant, which is totally understandable. This specific bacteria, Lactobacillus reuteri, is important and also interesting for me as a pain physician as well as a lifestyle medicine physician. This one is one of the human gut microbiome that is found in human milk. This is first thing that you are introducing to the children when they are growing up, and this has got a pro-inflammatory immune modulation. So if the lactobacillus reuteri is reduced, or the breast milk is not given to the children, or the mother has got less lactobacillus reuteri in their milk, which is happening because of the lifestyle changes, this can lead to central sensitization and chronic pain development in later life for the children. And what was interesting was when they were studying this, they have to go to the indigenous mothers to get the lactobacillus reuteri in the breast milk. Many modern moms were lacking this specific bacteria in their breast milk, which is probably explains why the chronic pain is also rising in the Western diet world. So the healthy plate concept is something that the lifestyle medicine boards across the board is introducing. So we encourage plant dominant or plant predominant whole food, as whole as possible, as close as possible to the natural environment, with healthy protein, which predominantly comes from either clean protein, animal protein, or predominantly plant protein. So when we talk about animal protein here, sometimes I do ask my patients to completely avoid all animal proteins in their diet, especially if they have got autoimmune diseases, because animal protein is something that can trigger autoimmune reaction in many patients. So we advise, or I advise them to take a plant-based protein rather than animal protein, especially if they are farmed with the antibiotics as well as the steroids in their diet. Otherwise, go for whole grains, healthy protein, and predominantly half of your plate originating from the vegetables and the fruits. So this is the Sri Lankan Nutritional Coordination Division. But if you look at this one particularly, you can see half of the plate is almost a carbohydrate. So high carb diet is one thing that we are discouraging, especially for diabetic people, because this can be a problem for them to digest as well as manage the sugar control at a later stage. So one good thing about the carbohydrate in the diet is in the part of our world, we have something called millets. Millets are complex carbohydrate with some protein content, and also it has a lot of other health benefits as well. So when patients are going on to a diet to control their diabetes, we encourage the patients to go to complex carb, use more millets in the diet instead of polished rice or refined carbohydrate, which not only has got the carbohydrate and the protein, but also high fiber content. High fiber content is something that will help with your weight reduction. You are reducing the insulin, hyperinsulinemia, as well as improves your insulin sensitivity, and also hyperlipidemia. So does it matter how you eat? And this is an interesting study that was published in a Sri Lankan article actually. There is a glycemic response depending upon how you prepare your millet as well. So if you parboil, that is good. That is a low glycemic index. If you make it into smaller particle size flour, you may have a higher glycemic index. And if you are roasting it raw, you may have high glycemic index. So it doesn't mean that you are eating millet. How you prepare it, how you eat it matters as well. Legumes are another good source of fiber as well as protein and complex carb in your diet. So if you compare animal protein with the plant protein, which is in the legumes, you can see that probably in a 1 cup of chicken, you may have more calories and more carbohydrate, more protein. But in the plant protein or the plant beans, legumes, you have got more nutrients. So we are talking about the nutrient-rich diet rather than calorie-rich, high-fat diet. So there is no way we can say that the chicken is a better protein compared to plant protein. Animals cannot make protein. They take it from the plants and they store it, just like humans are. So if you want to go to a vegetarian diet or vegan diet, do not think that you will not get enough. The amino acid, which is the building units of protein, is coming from the plant origin. The second component is the activity or the exercises. We encourage all patients with the diabetes to be more active and also have targeted exercises. So this is a pyramid that we say. Limit the physical inactivity or the sedentary life as much as possible. At least 2 to 3 days a week, you should go for the flexibility and strength training exercises. 3 to 5 days a week, you should, if you can, go brisk walking, football, badminton, or whatever it is. Every day, try to do the normal activity at home, and also climbing a couple of stairs, especially in the evening, will definitely make the sugar level better in the morning. You don't need to go to the gym. I tell all my patients, do what you can do. If they are females, I tell them, do something while they are standing in the kitchen. Dance. Put a song and dance. You don't need to go to a gym for doing exercises. This is something that you can really do when you are at home as well. So there are various exercises that encourage my patients to do, which you don't need an equipment. You can do it anywhere in the house or at workplace, and keep moving. That is the most important bit. Now, the exercise, why it is important, it is not only just for losing the weight. Losing weight with exercise doesn't really work, but it makes the muscle more insulin sensitive, and also liver, the insulin sensitivity goes up, and the circulation improves, which will reduce the blood glucose, as well as your pancreas will start more beta cell mass and increased insulin production. And in the adipose tissue, which is the primary problem in diabetes, reduces the inflammation and increases the insulin sensitivity. So the exercise is not to lose weight, but to make your diabetes and the insulin response much better. So the type 2 diabetes, when you are doing exercise, this is again another article, which is a very interesting article. When you do have type 2 diabetes, you have vascular stiffness as well as cardiac dysfunction and muscle dysfunction. This will lead to decreased functional and the exercise capacity as well, which will increase your cardiovascular risk as well. And this is like a cycle going in circles. So what are the barriers for exercise when you are a diabetic? So physical, which is because of the discomfort, pain, and aches and stiffness that the patients experience. Pathophysiological, because their cardiac reserve is less, and also the pulmonary pressure is normally high because of the pressure. And also the hypoglycemia that patients may experience if they are on multiple medications as well. So the diabetes complication related as well, you can get neuropathy, nephropathy, or the kidney damage, and they lose their vision or the balance, and also the social and psychological, because they are depressed, and also diabetic distress, and the community culture is also preventing them from doing exercises. So we need to encourage the patients to go and do more activity, whichever form or shape that they can do, even at home, encourage them to be more active, whichever way. And also exercise improves your gut microbiome. We are coming back to the gut microbiome all over again. The exercises like Tai Chi or any kind of exercise which will improve your gut microbiome, increasing the insulin sensitivity for you as well. And there are few articles if you are interested to look into how exercise helps with your gut microbiome as well. The third one is the stress management. As I told you, the stress in the modern lifestyle has gone through the roof. I encourage my patients to do something like yoga. Yoga is not a religious thing. It is just simply means the fusion of mind and body. Why yoga? I suggest because some form of the yoga, especially, it moves every joint and every muscle in the body. So it is not just walking or doing one part of your body. It helps with every joint movement and muscle. And also you can do it without any equipment at home, anytime at your convenience. And also that increases your lung capacity and also produces vagus nerve stimulation, which I will be coming in a minute. So how the relaxation response is produced when you are doing a yoga or any of the exercises. So if you look at the pathology, stress produces the sympathetic nervous system overactivity through the epinephrine, norepinephrine, which we are familiar, but through the HPA axis, which is the hypothalamo-pituitary axis, it produces cortisol. Cortisol is the mother of all diseases. So while you are managing the stress, actually you are reducing the cortisol and the stress hormone and its effects on disease formation. So the vagus nerve stimulation, which is the parasympathetic nervous system, which is the master switch of your body, it get activated and you get all these results or the effects of your the stress hormones on your body reduced. So involvement of the sympathetic and the parasympathetic nervous system is very important for your well-being as well. So when you are having a stress management period or any activity to reduce your stress level, what you are actually doing is enhancing your parasympathetic activity through the vagus nerve, which controls almost all organs in your body, and it reduces the stress level hormones as well. There are various simple things that you can advise your patients to do. Breathing techniques, the pranayama techniques, it is very simple. Anybody can do it. Meditation, humming, cold shower. That is one of the reasons why the cold therapy works for majority of these patients. Auricular nerve stimulation, because the tragus of your nerve is innervated by component of the vagus nerve. Connect with the nature. That is why keeping the positive attitude and connecting with the other people helps as well. Probiotic omega-3 fatty acid and also intermittent fasting. I will go through the intermittent fasting and the couple of slides later as well. So the breathing techniques is something that you can do as long as you are alive, you are breathing. So you just need to manage your breath work and you will be able to do the vagus nerve stimulation through various pranayama techniques or the neuromodulation techniques through the breathing work. That is me. I have to say the vagus nerve and the vagal toning, vagus nerve stimulation has helped me tremendously to come out of the long COVID symptoms, which I developed following the COVID infection. So this is a study which I specifically practice one particular yoga. And this is the evidence from the Isha yoga practices, which you can practice any yoga, any exercise form. It doesn't have to be a very particular yoga or anything. But what I'm trying to say is it helps with the relaxation response. And it is not just the relaxation, it is the hormonal changes and your glucose metabolism that get affected through the vagus nerve. So the non-invasive vagus nerve stimulation you can prescribe to your patients. As I told you, the stimulation of the ear tragus is one, or you can get the external stimulator, which can be prescribed to the patients as well. So how does this work? Because the brain-derived neurotrophic factor, glial cell-derived neurotrophic factor, along with the nerve growth factors are increased as a form or the result of yoga or meditation or mindful relaxation. And all these ones helps with the cell survival as well as the cell healing in the body. Intermittent fasting is something that people ask whether that can be done for diabetic people. Definitely. So there are different types of intermittent fasting, and I'm not going to go through what type should be the best because it has to be decided with the patient depending upon their medical condition. But intermittent fasting does help, one, weight loss, two, it makes your liver function better, as well as your insulin sensitivity in the periphery better, and in the muscles better, as well as changing your gut microbiome. So there are several articles where you can see the intermittent fasting as a treatment for obesity as well as overweight management, along with the diabetic patients, how that is helping the diabetic patients to control their sugar levels as well. So these are different articles that you can find as a review article or a multi-center randomized controlled trials as well. The fourth one is the sleep hygiene, which is so important. The circadian rhythm, again, and the sunlight that we have to have the circadian rhythm set in, because as soon as the sunlight falls on your third eye, we call it as third eye, which is the suprachiasmatic nucleus, which is your clock, biological clock, that will control your all the sleep hormones that is coming from the pineal gland, melatonin, as well as your HPA axis. So having that sunlight in the morning, as well as having that circadian rhythm is very, very important for you to control your sugar levels, as well as all other hormones in your body. It also controls your gut microbiome. So if you are sleep deprived, your gut microbiome will change. That will affect your glucose metabolism as well as your immunity as well. Another aspect is the sunlight, which is important for your vitamin D production, and vitamin D and sunlight is linked with the diabetes as well. So when you want diabetes,
Dr. Athmaja, forgive my intrusion. In case the current link expires, there's a separate link which has been inserted in the chat. Please click on that.
Sure. Yeah, sure. Okay. So what is the positive social connection? One is the microbiome and the well-being of your mental status as well. So all the happy hormones that we are producing is coming from the gut microbiome. Even the serotonin that you are having, we give SSRI as an antidepressant. Only 1 to 2% is available in the brain. Rest is in your gut. So if you are looking after your gut, the serotonin in your brain is going to be low, which is one of the reasons why patients feel very depressed. And the modern diet is another reason. So there are again several articles where anxiety depression is linked with your gut microbiome. So changing the gut microbiome or treating the dysbiosis, that will go through the gut-brain axis, which is one of the best treatments for your depression as well. Specifically, the subdiaphragmatic part of the vagus nerve is the key role in treating the compression, the gut microbiome, because it is controlling the gut, which is one of the reason the vagus nerve stimulation helps with your immunity as well as your depression as well. So the autonomic nervous system control is very important for diabetes as well as the pain management through the relaxation response. As I mentioned, the gut microbiome and the gut-brain axis is a bidirectional control from the gut. The neural axis as well as the immune pathway will go through the brain, and the brain will control it through the autonomic nervous system as well as the enteric nervous system, which is supplied through the vagus nerve, which controls the neuroinflammation as well. The other one specific for liver diseases as well as diabetes is the gut-liver-brain axis. This is important because it controls the glucose metabolism as well as the insulin production in the body through the change in the dysbiosis as well. So the vagus nerve is the master switch of your autonomic nervous system. If you can manage the gut microbiome as well as your vagus nerve, you will be able to control a lot of your hormonal imbalance, including the insulin production and the sensitivity of the patient. So the diabetes, COVID, and the lifestyle as such, non-invasive vagus nerve stimulation, which was used in COVID patients recently. This is a randomized control trial called SAVIOR, where they were looking at all the long COVID symptoms controlled through the vagus nerve stimulation and the gut microbial dysbiosis correction. And this is even important because the COVID-19 was severe in patients who had gut microbial dysbiosis. And these are the two review articles where they said the gut microbial composition reflects the disease severity and the immune response, as well as the gastrointestinal symptoms associated with the COVID in the severe COVID patients were related to the gut microbiome as well. As you know, angiotensin II modulation was one of the targets for COVID treatment, and even that is controlled by the gut microbiome intestinal inflammation as well as the coronavirus infection. So you can see how these are all interlinked with the diabetes, why the diabetic people had worse COVID infection, and how this is modulated through their gut microbiome as well. So risky substances, as we all know, drugs, smoking, alcohol, and sugar, that all produces addiction, and sugar is probably more addictive than any of these. And this is something that we are giving through the high sugar intake in our children as well. So how can we save or make a more gut microbiome? Fiber is the most important macro element in your diet. Choose prebiotic rich food, which is the rainbow colors, which is the legumes, fruits, vegetables. You can take probiotic, which is the fermented food. Avoid antibiotic use unnecessarily, and also avoid or reduce animal products, especially processed food, which will enhance the bad bacterial growth in your gut. Avoid or limit high fat and oily fried foods. Practice healthy lifestyle, which is your diet, exercise, sleep, and stress management, and positive social connection. Intermittent fasting, I already mentioned. Even fecal transplantation has been described. Fecal transplantation is successfully used in ADHD as well as Clostridium difficile infection. So even in patients who has got other gut issues and even treatment, this has been proposed as well. So the future, the gut microbiome will be the next 15 years most important aspect in the healthcare sector. The future medical care might look like, instead of your face recognition, tomorrow it may become your fecal recognition. Because instead of the blood test, you can detect your gut microbiome as well as the stool markers, which will predict which microbiome is missing from your body and what needs to be given to treat your medical problems. Actually, it is already happening. There are centers who are looking at the patient's stool sample as a first set of testing along with your blood to figure out what treatment will be the best one for the patient. So even future COVID vaccination is going to be based on gut microbiome. And this is going to be like a new aerosol intervention, because that is going to look at the AC2 genome, which is dependent on the gut microbiome. So the paradigm shift is needed for all the chronic diseases, healthcare and well-being, specifically the type 2 diabetes. So we need to look at the gut microbiome completely differently. It is not only the weight reduction, it is not only just having low calorie, how you eat the food, what type of food you give, and exercise, even stress management. All these affects your gut microbiome at the end, which is helping with your diabetic management. But we need to think, where is this microbiome coming from? How can we improve the diversity of the gut microbiome? Sorry? So where is the source of the microbiome? It's actually coming from the soil. So this is opening up a new area. As physicians, as human beings, we need to be mindful as well, because the soil is dying. So the next generation, our children, are going to get less nutritious food with less microbiome in their food, in their body, which is going to affect their health. This is already happening and already being predicted. The global change and the soil change is going to affect the microbial diversity, which is going to be a human health perspective. This is also linked with the high incidence of diabetes, obesity, depression, inflammation, as well as other lifestyle-related diseases in human beings. So what should we do? Along with the treating our own patients now, we need to save this for our future generation as well, our children. If we want to leave this world as a better place for them, look after the soil, improve the microbial content in the soil so that our children will get better nutrition through the plants and the plant products that is reducing. So the soil is feeding you actually through the gut microbiome or the soil microbiome, which is coming as your nutrition. So look after the soil, because the soil is dying as well. So as take-home message, I would say, type 2 diabetes is a lifestyle disease, and it is possible to put remission or reversal, whichever term you want to use, through lifestyle adaptation. Lifestyle interventions are a sustainable solution for the patients without medication, or reduce it to reduce and reverse the complications. All 6 pillars of the lifestyle medicine approaches are important parts and they need to be addressed. Gut microbiome through the gut-brain axis and the gut-brain-liver axis play a very important role in all 6 pillars of your diabetic remission reversal program. So as important it is to look after the gut microbiome as well. Save the soil for our future generation, because they need to have this microbiome for their health in the future as well. I will go back to that study or case study, which I did. This was his first blood results, just a reminder for you. He went through the lifestyle program, which I run as a 6 weeks program. And I managed to stop all his medications by the 2nd week. Now, after 6 months of follow-up, no more fatty liver, energy levels are high, he's in a happy mood, his MSK pain situation has settled, partial smell sensation is back, and quality of life improvement in all aspects, personal, professional, sexual life, and also his emotional well-being has been improved as well. And as the parameters say, his weight has reduced from 76 kilo to 60. So he lost nearly 16 kilos and also nearly 4 inches of his waistline. That showed in the HbA1c, which is 7.5 to 5.8. So this is in normal age, not even pre-diabetic range. Triglyceride level from 179 went down to 93. And HDL is from 23 to 45. So the triglyceride to HDL ratio is now in the safe range, which reduces his cardiac risk as well. I had to supplement vitamin D because vitamin D is linked with his diabetes complications and the diabetic development as well. So that is supplemented and kept in the normal range as well. So diabetes reversal is possible as well. Thank you for listening. As we say, the nature has created your body as a wonderful machine. We all have the courage and capacity to heal by itself as well. As physicians, what we need to do is encourage that and also give the body a chance to recover by giving all these things, the lifestyle interventions around, along with the medication to get the best outcome as well.